Hello, I'm Isabella and I'm 7. This is a film all about the operation that I've had. You might need to have it as well. Let me tell you all about it. An alveolar bone graft, or ABG, is an operation where a surgeon takes a small piece of bone marrow, that's the soft bit inside your bone, from your hip and puts it into your gum to make it stronger. Alveolar is another name for gum. A bone graft just means moving bone from one place in the body to another.
Hi, I'm Scott, the orthodontist with the cleft team. Some children born with a cleft of the lip or the palate might also have a gap in their gum, which they can see in the mirror when they look inside their mouth or even feel with their tongue. This gap means that some of your big teeth may not be able to grow through properly. But filling the gap with bone will help to support the growth of your big teeth. It can also help with the support of the bottom of your nose too. When we do an ABG will depend on how you're growing your big front teeth. We start looking at this from the age of 7 and hopefully get your ABG done by the time you're 8. Should we have a look and see how your teeth are this morning? Yeah? Let's sit you back and have a look then.
Your operation will take place at the Bristol Royal Hospital for Children. This is a children's ward where you will stay in. There are lots of children having different operations. You can have your own really big bed and it is really comfy. What can make it even comfier is if you bring your own cuddly toys and familiar things from home. It can be helpful to write a list beforehand of all the things you want to bring. There are lots of nurses in the ward whose job is to look after you. They will help you get settled in and make sure you have everything you need. They will measure you to see how tall you are and weigh you to see how heavy you are so the doctors can give you the right amount of medicine.
Hello, my name's Charlotte. I work on Penguin Ward. I'll be one of the nurses looking after you when you come in. We look forward to seeing you soon.
The surgeon will come and see you. He will talk about the operation to your parents and he will check if you are fit and well.
Hi, my name is Shahil. I'm one of the surgeons of the Southwest Cleft Service. I'm available for you to ask me any questions you want about your operation before enjoying your stay in the hospital.
You are not allowed to eat or drink anything before the operation. This is to stop your tummy being sick. This is the playroom where you can come and play games, do craft or talk to one of the play specialists.
Hi, my name is Demi. I'm one of the play specialists. Part of my job is to do preparation and distraction, but also to give you fun things to do whilst you're in hospital. So when you come in, let's have some fun.
When it is time for your operation to start, you will be taken to the operating theatre by a nurse and one of your parents or carers. A doctor called an anaesthetist will come and see you.
Hello, my name's Natasha. I'm one of the anaesthetic doctors at the Children's Hospital. It's my job to give you some special medicine so that you won't feel anything during your operation. There are 2 ways to go off to sleep. One way is to have some magic cream on the back of your hand, which will make your hand nice and numb. Once that happens, we'll pop a small drip called a cannula in the back of your hand and the anaesthetic medicine will go through there and you go off to sleep really quickly. The other way to go off to sleep is to breathe some special anaesthetic gases through a face mask. This also works really fast.
You will sleep through the whole operation, which lasts for about 2 hours. The anaesthetist will stay by your side to make sure you are okay. Your parents will leave the room, but they will not be far away. Because you are asleep the whole time, you will not feel a thing. This is the recovery room where you will wake up after your operation. A nurse will be there to look after you. She will call your parents or carers as soon as you start to wake up, so they will be there to welcome you and give you a cuddle. You will then be taken back to the ward. Your mouth will have stitches inside and may feel a little bit numb and groggy when you wake up. Your face may be a little bit swollen and puffy too. Both of these things are normal. You will be given medicine to help with any pain. You will also have a small plaster on the scar on your hip. You may not want to eat very much at first, but when you do start to feel hungry, you may want to eat soft foods like mashed potato, yogurt or ice cream. It is also good to avoid pointy foods like crisps because they may hurt the scar on your mouth. Also try not to eat sticky food like white bread or gummy sweets. It is important to look after your teeth with good brushing during this time. You may need to stay in the hospital for one night. Your parents or carers will be able to stay, but only one of them. You can usually go home the day after your operation. It is really important to rest for a week after the operation to give your mouth and leg time to heal. This is a good time to catch up on sleep, play computer games, do jigsaws, draw or read books. You can go out to play a week after ABG and back to school after 10 days, but you have to be really careful not to bump or knock your mouth or hip. You will not be able to play sports where your hip may be knocked, like rugby or trampolining or football.
Hi, I'm Jenny. I'm one of the psychologists from the Cleft Service. A psychologist is someone who can help you with any worries you may have. It's really normal to be a little bit scared or worried before you have an operation, especially if you haven't had one before. If you find you're worried, talk to your mum or dad and they can give me a call. I may be able to help you find a way to manage the worries so they don't bother you as much. I've helped lots of children who worried about their operation, including Isabella, and they've all managed to come through it, and so will you.